dictionary definition of digitalization is. So digitalization is the process of converting information into a computer readable format. Another one says that it's the conversion of texts, pictures, or sounds into a digital form that can be processed by a computer. Another one says that it's the adaptation of systems, processes, etc. to be operated with the use of computers and the internet. So that is the foundation of what we are here to talk about today. So talking about this with respect to blood is that every activity, all the processes that we have been talking about for almost 2 years now at the Lagos State Blood Transfusion Service, we are converting it from the pure manual form into a computerized form. That's just the summary. And beautifully so, we have tested it. It's been on for a while, really. We've been using it. You know, when you have a new system, we can't just change from completely fully manual to a fully digital form. So there's a transition, and in this transition I've done a pilot study, and I think it's good enough for me to mention the name of our digital format. This digital format has a name. We call it Emo Central. So when you hear Emo Central, what has Emo Central done? Have you have you imputed it into Emo Central? The name of our digital system at the blood transfusion service is Emo Central. And it tells you from the donor side. Look, before now, anytime you go for our drives, you've joined us before, we're always writing with paper. Now you will see some people writing with paper because some people still like the paper format, but you have computers there, you have QR codes on the walls so that you can scan your QR code for you to go straight into the system, that's straight into Emo Central, for you to answer all those questions. And once you answer all those questions, the computer recognizes you. It's like machine learning. When you're coming back next time, it already knows that you are back. All your information is there. We can know how many times you've donated and things like that. So really, it's a very beautiful thing that we are transitioning from biro and paper. I know in this world of AI, this is just the right thing to do.
I know we talked about incorporating AI into the blood transfusion process and the screening process and the registration process, and you talked about the fact that that was coming on stream. So I'm glad to see that it's fully functional right now.
It's finally here.
It's finally here. So for a lot of your blood donors in the community, what are the benefits and advantages? I know you've talked about the fact that you have easy access to their information in the database, but what other advantages does digitalization have for Lagos State and the donors?
So first, you said it, they have easier access to logging in. They can have their appointments made on the digital system on Emo Central. They can have appointments. You can expect them beforehand. They can have not just appointments, they can have appointments or donation drives. So they can send a message to us instead of coming in person or sending letters. They'll just log in and register their interest to have a voluntary blood donation drive. They can also have their history downloaded with just one touch. Many times it is difficult for us to know all the units of blood anyone has donated because it's in paper format. If they lose that documentation, then it becomes difficult. We have to start looking at our CRM and start typing in the Excel sheet and things like that. So they don't need to come to us for that. All you have to do, once you have registered on Emo Central, you have your own personal logins, and you just log it in, and you can see the history of all the things you have done in time past. Also, Emo Central does not just involve donation, having information about donors. It also links into the blood bank, and it links into the screening center, as well as the Hemovigilance portal. So once you have screened and you want to know your results, we can give you, if you are a donor, there's a way you could have the access to know your results. If anything has happened to that unit of blood, or maybe when you were donating, somebody had a donor reaction, or if somebody was being transfused and they have a reaction, there is a Hemovigilance portal. So it helps to strengthen safety above all things, there's something we call traceability anywhere in the world.
Yeah.
The most important thing about safe blood is not just that we've screened the blood, but we are able to trace the blood from end to end. Understand? It's really important. So Emo Central will strengthen traceability, and that is one of the key components that the African Society of Blood Transfusion looks out for when it comes to accreditation. So really, we cannot have our accreditation without doing this. So it's really it's a everybody win all thing by having Emo Central come up on board at this time.
So how has this in any way, well, I'm sure you are, but let me just ask, how easy has it made the work of the LSBTS?
So really, digitalization of services is supposed to make things easier. But right now, we've just started. We still have the ease. We have to get used to the system, you know. Some people are not computer literate. They have to learn it. So right now, overall, it is easy. For example, something happens today. I need to tell you. Because it prints out barcodes. You don't need to write on sample bottles, and so it prints out barcodes. So something happened yesterday, and they were unable to get their barcodes, and they were unable to walk. And I'm like, they've gotten used to the ease. So now, before they used to write a lot, all the donor needs to do is probably write his name, and then once it comes to the system, if your barcodes come out, the barcodes are used, they are the identifiers for the donor. You have the barcodes on the blood bag. You have the barcodes on the sample bottles, such that when it gets to the blood bag, you're just scanning it. So all those paperwork and documentation is not longer there. Sometimes when we are doing it, it feels like, oh, are we outside the country? Is it really true? So hope you understand. So for us, because the pilot started from the blood transfusion service headquarters. So it has, initially it was a bit difficult. Sometimes internet services are quite poor. So when there are poor internet services, it could be very, very frustrating. And so we have had options of trying to have alternatives. So once one is a bit slow, we move to the next one so that it does not disrupt services. But generally, it makes work easier. There is more time in between donors, as in attending to donors. You don't need to start writing all those long documentation and filling multiple forms. You need to see the way we fill forms and fill documents and fill books just to be able to document all this information. Everything is embedded in 11 numbers. That is from the barcodes.
Yeah. So I like the fact that you talked about the signals, network services that could disrupt the smooth running of this process. Do you have maybe a thinking or a plan in place to collaborate with any of the service providers for a better service delivery? Because, as you said, once there is a service or a network disruption, then it could just delay the whole process. Are there plans? Are you thinking about that kind of collaboration for ease of the process?
Yes, definitely. We are thinking about it, and honestly, we are looking at the one that seems to be the best so far, so that we can reach out to them. We're really thinking about it, and if they are here listening to us, please step up your game. Come to us. It's an opportunity for us to partner and collaborate for better service provision.
All right, it's still Safe Blood Arena on Lagos Traffic Radio 96.1 FM. We have been speaking with the Executive Secretary, Dr. Bodunrin Osikomaiya of the LSBTS, and we're discussing digitalization of digitalizing blood services in Lagos. So for clients, Lagosians, those who make use of the end product, how can they key into the digital LSBTS?
So, because we are launching tomorrow, yes, I think it's an opportunity to tell everyone. We are launching the Emo Central comes with a website. So before now, you used to ask that we don't know where to donate blood. Nobody's educating us. So I think you should know that there is a website that is attached to the Emo Central. So once we launch tomorrow, we will let everybody have the links to the website. Immediately you get into the website, there's an icon that asks that, do you want to donate blood? At that point, when you click on it, you enter your details, you are automatically registered. Once you're registered, you can have an appointment for donation. If you are not yet ready to donate, you can tell them that you just want to register, and then the system will continue to remind you and give you educative materials, and anything will do just gives you information. It pops up on your screen for you to know what is happening at the blood transfusion there. So that's the best way. That's the only way donors can be involved in it. You need to register. You need to be active, just like you are using Instagram or you are using what do you call it, Facebook, and they're all linked together anyway. So once you come onto the website, you can have the links to our Instagram, Facebook, X, and LinkedIn handle. So just like you are browsing the website, the web, or you are on social media, then you can also be a part of the Imo Central through our website.
Okay, so is this digitalization process now not going to make some people miss the fact that, because now it talks about the fact that once you click on the site, you can get readable materials, you can get your counseling session, so to speak, via that. What about the human?
No, it doesn't stop it. It doesn't stop. You still need to have, so before you register, you are reading it. Before you donate blood, you must be counseled. It's just like you're having a HIV test. I know that you will be tested for those things, and so you must have a physical counseling session. Apart from that, just because you've read something online does not mean you don't have questions to ask. So there is still that part where you will have interaction with BTS staff at the time of blood donation, so that you can ask, as in if you have some things confusing, if you have queries, and if you just want to talk about it, but you still need to be counseled. It is following that counsel that you can sign the consent form. So you must sign a consent form.
All right, cool, no problem. All right, so let me ask Taiwo, so you don't feel like we have left you out of this.
No, I'm okay. You ask all the questions, really.
So he has back-end access. He's a quality consultant. He knows when there's an issue coming up.
Exactly.
So he has so much. He might even be more knowledgeable than me.
I know that.
So this you know so much. I know constantly every week we talk about. We'll take a look at this blood safety and blood security. How do you think digitalizing the process will improve the safety and security, of blood in Lagos?
Yeah, thank you. I think it's the perfect solution. To what
you would now, the process now.
Said earlier, traceability. Traceability is key in the blood service. We have to be able, like I'm sure I've said it several times, vein to vein. So that's traceability. You have to be able to trace every unit of donation to the point of transfusion, and that is made very easy with this digitalized system. Before now, it's tedious. You have to look for a lot of records. You have to open registers and look for things physically. That can take several hours. But now every donor and every donation has a unique number. And the screening center has got a unique number. The blood bank also gives it a unique number. And then all these things are linked. Everything is linked. So all you need to do is, with the press of a button, you key in the number you're looking for, and you see what happened to it at the end of the day. That is absolutely important for safety of blood. Globally, it is a very important thing, that because a lot of times they need to retest things and trace things for different reasons. So it's very important. The other thing is, at the end of the process, there's a label that is printed by the LSBTS. This label now is high-tech label. Now it moved from the old label. It has a QR code and 3 barcodes on it, and that increases the security and safety and quality. Yes, we'll be doing all the quality activities that we need to do, using good screening procedures, but quality is not complete until you can secure the blood that you have, such that you don't have people adulterating things and using the wrong labels and things like that. And this is a unique label. You can't get it anywhere else. Because, and the good thing about it is, the recipients or the doctor or the nurse can scan the QR code and see the details of that unit of blood before the transfusion. So it is certified that yes, it is from LSBTS. It's not from anywhere else. Because the QR codes and the barcodes are unique. Once you scan the QR code, it gives you the details of the units of blood. And that is the highest level of safety and quality. So this digitalized system means Lagosians should just go to sleep knowing that LSBTS are taking care of all their blood transfusion needs for those that need it whenever they need it. So the doctors and the nurses and the users of blood in Lagos should feel safe. There is nothing to worry about again.
Does this Imo Central, does it also give tell you how much blood you have left in the donor? Does it?
No,
it doesn't.
No.
But it just tells you how much you have collected.
No. So it tells you how much you've collected. Really, I think I should just mention something so that I can try to strengthen what Oloko said. Before now, if you collect a unit of blood from anywhere, you have to call the blood transfusion service to ask them that, please, is this certification number for this particular unit? So you need to call. But now, all you have to do is take your phone, and what you see is the day the unit of blood was collected, the day the blood expires, the blood group, the resus, that's the blood group, and the resus. It tells you for some, well, it's not compulsory really. The genotype is an alternative. It gives you the unique certification number. It gives you the unique blood bank number. It tells you the results of the test, HIV 1 and 2 hepatitis B, hepatitis C, and syphilis. It tells you where the blood was screened. So before now, you don't know where the blood was screened. So if the blood was screened at Alimosho, you can know there. If it was screened at Ibejuleki, you will know where the blood was screened. And finally, it tells you the volume. So you know how much blood was collected from that person. So it does not tell you the level of the blood of the recipient. That is for the doctors to put in the patient's clinical details or their EMR. That is electronic medical records.
Sounds good. All right, so for a lot of people who are still probably those who are not computer literate, who are also blood donors, how can they key into this? Because as you said, if you are computer savvy, you're internet savvy, yes, you can easily navigate your way through around this. But for those who are not internet savvy, they're not computer literate, but they're also blood donors and they do it regularly. So how can they key into this, or how can this assist them, to make the process slightly easier for them?
So now I mentioned that it's a transition process. We still give people the option of using paper documentation. Apart from that, before now, we've always had people at the registration stand supporting the filling of those forms. Because if you do not support, some people do not understand some questions. Some people might understand and they will skip it because they don't feel like answering it. So we always have people at the registration stand already supporting donors to ensure that they fill it the right way. So those people are the ones that will support those people. So they already have their computer. So if you don't feel, or you tell me that you don't have internet services, or you don't have the phone, because if you don't have internet services, you usually go with a modem so that you can have access to internet there. But let's assume that you don't even have an Android phone, or you don't have a device. You can always sit down with any other person there who will support you, help you to fill in the form. And then if you can't fill your form yourself on the internet, on your tabs, or on the computers. So they have support. As I said, it's a new thing for many people. So this is a period where everybody's being supported until they get used to it. So once you get to the centers, you will always find somebody that will support you. I mean, if you still want to use your paper, no problem, we allow you to use your paper. But you know the funny thing, anytime they start using paper, they're like, you done already? You know, that kind of thing. You done already, because it's faster. It's the same questions, but I just clicking, the way it is. Are you done already? All those parts of the forms that seems like it is a replicated as a repeated question, the computer, once you answer one, it automatically fills in all those details. So people are beginning to have that interest. Even those that do not know how to write will tell you that, I prefer this system. So it really is a good one.
All right, good. So for Lagosians, what else do you have in store for them as regards digitalizing the blood services in Lagos? So as an not improvement but an extension of this beginning this level.
First of all, this is novel. We have been on this for at least 20 years. Ever since the blood transfusion service was created, the people that created knew that they needed to digitalize services. So it's not like we thought about it out of the blues. We have even registered with the International Society of Blood Transfusion before now. So I want Lagosians to know that we did not just decide to start this. It has been tried before. It has not. A lot of things have been going on for over 20 years, and this is coming in at the best time. So I want Lagosians to know that this is safe. This is registered with data protection codes, the Acts. And so we are abiding with the Data Protection Act. Many people are worried about their details being leaked out to the dark web, so they shouldn't worry. Based on everything that the Data Protection Act said, we are abiding by it. We have people, our staffs, they have integrity. They are they be rest assured that they will not leak out information from their heads too. So just try it and you will enjoy it. And the best part of it is when you click and you see that all your details, you can know where your blood has gotten to. So all those end to end, vein to vein you talk about, you will see it easily with the click of one, just a click of one icon there.
One click of the mouse.
So
for this is novel, as you said, and so you just might be receiving tours from people from outside the state who will come to learn about it, what the process entails, what you had to go through, how to work the process. So I guess LSBTS is ready for that.
We are. I think we've been having something like that already. In the teaching, during our pilot period, we have allowed people to see. When people from outside see us, they're able to notice the gaps.
Yes.
I know that when we had people from Kano come around, we exposed them to it, and they're able to tell us some issues there. We have people from outside BTS itself, from even as close as the other general hospitals, because we have started implementing it in the general hospitals now. So using it, we're able to notice some gaps. So really, it's been very nice. And one more word, please. Tomorrow is our launch. It's happening at Providence by Mantis. Come and see. I'm going to have a lot of videos, showing the processes and showing how we have been able to get to this particular stage.
Okay, awesome. That's good. Thank you very much for being on the program, Dr. Bodunrin Osikomaiya. Thank you very much, Taiwo, Oloko, for being on the program also. This program has been brought to you courtesy Lagos State Blood Transfusion Service, and to reach them, the Facebook page is Lagos Blood Transfusion. On Instagram is Lagos State Blood Transfusion. On X is Lagos BTS. And the phone number to which you can send a message if you'd like to ask some questions is 0806 920 7914. Again, 0806 920 7914. Big thanks goes to Victor Oteri and to our executive producer, Tayo Akonle. My name is Dele Agadumo. Safe Blood Arena comes to you every Monday at 4:30 p.m. on Lagos Traffic Radio 96.1 FM.